Hi, everyone. I'm Dr. Sindhya Rajiv. I'm an emergency physician at Stanford University in California. In this module, we'll be continuing our conversation about vaccines, and Dr. Jennifer Newberry is with us.
Hello, I'm Dr. Newberry, also an emergency physician and faculty at Stanford University. I'm looking forward to continuing our vaccine discussion. In this second part of the vaccine lecture series, we'll cover vaccine side effects, who can get the vaccine, and what to expect.
Great. To start, Dr. Newberry, what side effects might people expect after they get the vaccine?
Side effects are real, but it's important to understand that the side effects are almost always a sign that the immune system is doing what it is supposed to be doing, responding to the vaccine and producing antibodies that can then protect people from the real virus.
So what you're saying is that side effects are not a sign that the vaccine is harmful. Quite the opposite. They are a sign that the vaccine is successful, right?
Exactly. The side effects we're seeing are normal and expected with vaccines. These include things like pain at the injection site, fever, and fatigue. With vaccines that require a second dose, some people are experiencing chills and body aches with the second dose. These side effects usually start within a day after receiving the vaccine and last only about 12 to 48 hours. You can take ibuprofen or acetaminophen if you have had side effects after vaccination. We recommend that you do not take them beforehand unless you need to regularly take ibuprofen or acetaminophen for other medical conditions.
And let's not forget, these side effects are mild and temporary compared to what COVID-19 can do to people. Okay, so we expect side effects, but what about allergies? Is that something people should worry about?
Good question. First, check the ingredients in the specific vaccine that you have. For example, there are no egg products in either the Pfizer or the AstraZeneca vaccine, so people with an egg allergy can get it. But there is one ingredient in the mRNA vaccines that is known to be allergenic for some people. This is something called polyethylene glycol, or PEG for short. Meanwhile, the viral vector vaccines may contain polysorbate, which on rare occasions people are allergic to. Healthcare professionals should have a discussion with patients who have a PEG or polysorbate allergy to determine if they should receive the COVID-19 vaccine. If the patient has had a severe allergy to an included ingredient, they should not receive the vaccine. If a patient's allergic reaction was mild or moderate, the decision to vaccinate will be based on their risk of exposure to COVID-19 or having a poor outcome.
What about people who have had severe allergic reactions to other things, like medical products or even bee stings?
Medical providers administering vaccines should always ask patients about prior anaphylactic reactions. Doctors should discuss the risks and benefits of getting the vaccine, as mentioned before, with patients who have had any allergy. However, as a general rule, patients who do not have an allergy to an ingredient in this vaccine should be able to get the vaccine. Anaphylactic reactions to the COVID vaccine are extremely rare. Only 11 cases in 1 million have been documented for the Pfizer vaccine to date. Nearly all cases of anaphylaxis occurred within 30 minutes of the person receiving the vaccine. That said, it can happen, but very rarely. Anaphylaxis is something medical providers know how to treat. So if a patient has a history of anaphylaxis, they should be observed for a full 30 minutes after vaccination, rather than the standard 15 minutes, in order to identify and treat anaphylaxis.
Okay, let's talk now about recommendations for some specific groups of people, such as people who are pregnant.
Sure. The WHO does not exclude people who are pregnant from getting the vaccine. Here are some things to consider. 1. People who are pregnant who get COVID-19 are at a slightly higher risk of getting severe COVID-19, so protection may be especially important. Second, people who are pregnant were not included in the early vaccine trials, but studies are underway now. However, all of our previous experience with vaccines and the way this vaccine works gives us no reason to believe that the person who is pregnant or the fetus would be harmed by the vaccine.
So it ultimately sounds like people who are pregnant can choose to get the vaccine, right? But that they should weigh their risk of exposure.
Yes, exactly. Also, clinical trials that study the safety of COVID-19 vaccines in children are underway. Please see the handout for the latest recommendations for children and people who are pregnant.
What about people who are immunocompromised or who are taking immunosuppressant medications?
The WHO and CDC advises people with immunocompromising conditions or medications to receive the vaccine and recommends that healthcare professionals speak to these patients before they decide to get vaccinated. If possible, based on the patient's underlying condition, it is best to complete the vaccination at least 2 weeks before initiating immunotherapy. A link to more information on this will be in the handout.
And what about people who already had COVID-19? Do they need the vaccine? Should they wait?
Right now, the WHO still recommends that everyone eligible be vaccinated, including those who have already had COVID-19 in the past, because you can get infected again. Immune protection from a prior COVID-19 infection should last at least 90 days. So people who have already been infected may choose to postpone vaccination in order to allow the doses to go to other people. One important thing here, people who are actively sick or having symptoms should wait to receive the vaccine until they are recovered.
Excellent. How many doses of the vaccine need to be given?
It depends on which vaccine you are providing. Most of the approved COVID-19 vaccines require 2 doses, but the Johnson & Johnson vaccine, for example, only has 1 shot. Please see our handout for details. For the vaccines that require a second dose, after the first dose, the body begins to create antibodies, but as the weeks pass, this response will drop a little. When the second shot is given, this reminds the body about the virus and ramps up production of antibodies, again, to maximize protection that will last longer than 1 dose alone.
Great. So how long do I need to wait before giving the second dose?
That depends on the vaccine. For example, Pfizer, you will need to wait 21 days. For AstraZeneca, you'll wait 28 days.
That seems very precise. What happens if the patient can't get there exactly on day 21?
It's okay if the patient can't get the second dose exactly on day 21 or day 28, but we recommend getting it as close as possible to that 3rd or 4th week mark.
How soon after getting the vaccine are people protected?
That depends on the vaccine. For single dose vaccines, maximum protection can take up to 4 weeks after the injection. Meanwhile, for those vaccines that require 2 doses, it can take up to 2 weeks after the second dose. You are not well protected after the first dose alone.
So we are continuing precautions because even if we're vaccinated, we may be able to be infected with the virus, have no symptoms, and transmit it to others.
Exactly.
Let's quickly review what we learned about vaccines.
We explored what side effects can occur with the vaccine and learned that the side effects are a sign that your immune system is doing what it's supposed to be doing in response to a vaccine. We also discussed possible vaccine allergies and anaphylaxis. Remember, you should always talk to your patients about their allergies before vaccinating.
Finally, we learned that the CDC and WHO say that pregnant people, most immunocompromised people, and people who previously had COVID-19 may all choose to get a vaccine. Although again, it's recommended that you speak to your patients regarding this. And we ended by reviewing that maximum protection from the vaccine can take up to 2 to 4 weeks after the final dose, and why we should continue precautions after vaccination. Thank you, Dr. Newberry, for your time and your wisdom.
Thank you to everyone for sticking with us through all of this. We hope you feel empowered to answer your patients' and families' questions about COVID-19.
Don't forget to download the handout, which has additional resources in it. Take care, everyone.